All right, and we are live. Welcome, everyone. This is Hip Tips with Dr. Mark Hood, hip and knee specialist at Carolina Orthopedic and Neurosurgical Associates here in Greenville, South Carolina. Thank you, everyone, for joining again. Let's start with some basics. What is the hip?
Yeah, so thanks everyone. I appreciate you tuning in. If you have any questions at all or anything that maybe I can clarify for you, feel free to put the information in the text box and we can kind of answer those as we go or at the end if you have any further questions. So, like I said, my name is Mark Hood. I'm one of the orthopedic hip and knee surgeons, privileged to work at Kona in Greenville and also in Duncan, and glad to answer any questions. So, first question was about hip in general. It's a generic term. It's very broad. People come into the clinic in various specialties and say, I have hip pain. And what is that? So hip pain can be a wide variety of things. It could be outside the joint, as we call extra-articular, or it could be inside the joint causing issues, or it could be elsewhere that's causing the hip pain. And maybe we'll get into that a little bit today.
Great, great. So, what is the hip? Can you explain to us what the hip actually does, what some issues are with it?
Yeah, so it can present in a wide variety of things in terms of symptoms. When you say you have hip pain, so some people complain of groin pain, or some people complain of lateral hip pain on the outside of the hip. Also, some people complain of thigh pain that can be caused from problems in the hip. Can also people commonly come in and they say, I have knee pain, but you investigate them further and do a complete workup, and technically it's coming from their hip. And the reason is because of the way the nerves are oriented from the obturator nerve, fancy term, but the obturator nerve that innervates and supplies the hip capsule, but also supplies the inside of the knee. So sometimes when people say, I have hip pain or thigh pain or groin pain, it can be from a wide variety of things. Groin pain is commonly, due to problems inside the hip joint, while on the outside or lateral aspect of the hip, commonly in my clinic, I see what's called bursitis or inflammation of the hip, and we'll kind of talk about that a little bit further later.
All right, folks, if you're just joining, we're here with Dr. Mark Hood. He's a hip and knee specialist here at Kona. We're discussing issues with the hip here. So we're going to move on to our next question. What are common causes of hip pain?
Yeah, common causes. There's a lot. It's endless, and we're not going to be able to cover all that tonight. But if we can talk about a few different things and see if it can provide you with some information and maybe get you in the right direction in terms of if you need to see somebody like myself. But one is younger patients. So they commonly have what is known as a labral tear, which can cause hip pain or groin pain. And the labrum is just the outer ring of the acetabulum or the socket that can get torn due to trauma or various other reasons that can cause pain. There's also things called, like, fancy word, femoral acetabular impingement, where there's a deformity of the femoral head and or the socket that causes hip pain. Commonly in more athletic individuals that are younger, you can have stress fractures. So you can have fractures of the proximal portion of the femur, or the femur that's closer to the hip joint rather than the knee joint, that can cause pain. And then as we get older, some of those diagnoses change a little bit in terms of, do you have osteoarthritis, or commonly referred to on layman terms as wear and tear of the hip, where you get stiffness and increased pain in the hip or in the groin that's causing issues. You can also get various musculoskeletal and muscle strains. There's a lot of muscles around the hip, supporting the hip, crossing the hip, that can cause pain. As we continue to age, our bones start to get a little bit weaker, and due to the bones getting weaker and or medical problems, the bones can get weaker and you can get femoral neck fractures. So you can break around the femur once again, that require a special kind of treatment in each scenario. So there's a couple different things, and I kind of just ran through a brief aspect of that can cause hip pain and are common diagnoses in the hip. Also, broad term, tendinitis or bursitis, which is inflammation of a tendon or of a bursa, which is just a sac or an extra padding that nature has made for us in between a bone and a tendon, commonly throughout the body. And sometimes for various reasons, those can get inflamed and become painful and swollen and hurt. And that's when you need to, come see a provider, and maybe they have some definitely non-surgical means to help give you some relief and get your life back.
Right. What are some non-surgical options?
Awesome. Yeah. So non-surgical options, there's plenty of them. Some of them are going to work for certain diagnoses, but not necessarily for others, and vice versa. But in terms of hip pain and some of the general diagnoses, one is activity modification. So if you're an avid runner and you're running a lot, or you're a little bit older, but you like to get out and walk around the neighborhood or walk with your family, if things are causing you pain, we can modify your activities to see if that decreases your pain level. Something very simple, but something that we kind of overlook, both as a provider and also as patients, that we can do. So if it hurts, stop doing it, or decrease or change our activity level depending on that. Other is ice. So commonly, if there's inflammation around the hip or other parts of the body, if you have inflammation, ice is going to help. 10 or 15 minutes of ice in that area several times a day or even once a day is going to decrease that inflammation and decrease that swelling. Other things like over-the-counter medications, anti-inflammatories, either over-the-counter or prescription, are going to help some of that inflammation and some of that pain that's caused in there, such as like hip arthritis. So what happens with hip arthritis is the ends of the bone, the padding on the ends of the bone, begins to wear down, and the joint gets stiff and painful. And over time, with more activity or various activities, the hip gets inflamed and swollen and painful. And if we can use a couple of different modalities, both non-surgical, and exhaust all those as possible and avoid surgery as long as possible, then let's do it. And anti-inflammatories is a good proven technique to kind of help with that. And that's just for osteoarthritis, but it's used in a wide variety of other hip problems. Also, weight loss. As we begin to age, usually we add on a few pounds. I definitely have, but it can add extra stress through the hip joint or through the other anatomy around the hip. So for every pound that you gain, research shows that 6 pounds extra goes through the hip joint. So if you gain 100 pounds per se, then 600 pounds is going through that hip joint on a daily basis, and it's a reason for it to hurt. So another thing that I kind of counsel my patients on is weight loss if it's appropriate, and to provide them with that resources. Because if you just tell a patient, hey, you need to lose weight and walk out the door, which I've heard stories of, it's not going to work. But if you provide the patient with some resources, either conservative management, try this, try that, or get them over to a bariatric surgeon, not necessarily for surgery, but for evaluation, and also they have other surgical means and resources available, then you're able to provide them with more of a continuity of care and not just tell them to lose weight. And losing weight's going to help, right? We just talked about the calculation. Other things is physical therapy. So strengthening around the hip, the muscles around the hip, and taking pressure off and or stretching or moving muscles in a particular way with the aid of the physical therapist is a proven treatment that can help with hip pain in general.
All right, if I do need surgery, what are my options?
Yeah, I think it definitely depends on the type of diagnosis, obviously, on if you need surgery, and a lot of things you don't need surgery for. And a lot of people don't want to come to a specialist sometimes because they're afraid that somebody's going to say you need surgery and we got to do surgery more urgently or more acutely, but not always. So for various things, we can talk about the non-surgical means we just talked about, and some of those things in combination or in isolation work to solve and fix the problem at hand. But for my patients, if we're able to exhaust all those conservative managements that are out there that are proven, and I emphasize the word proven because there's a lot of modalities out there, and as we advance science and all that, there's different modalities that come out, such as like stem cells, where we really don't know the hard data behind it, if it's proven to help or not. And I'm not saying it doesn't help. There's patients that come in sometimes and they say it works, and that's great. So if it works and gets you from point A to point B and allows you to do what you want to do, then in my book, that's a success. But sometimes those modalities are expensive and cost prohibitory, especially in society today. And that's something I try to be cognizant of when I'm talking to the patients about, is the cost worth it? Is there proven research behind it? And can I explain that research to you so you can decide, or we can decide as a team, if this is the right thing for you? And in terms of surgery, there's endless amount of surgeries that we could talk about and diagnoses. And I think that's something I'd be glad to talk to you, or some of my partners would love to talk to you about, in terms of what's right for you, if you even needed surgery. But definitely in a Kona aspect is that we exhaust all conservative management as long as possible. And surgery is always a last resort, only if it's needed and only if it's going to help you.
Once again, we're here with Dr. Mark Hood. He's an orthopedic surgeon here at Carolina Orthopedic and Neurosurgical Associates. He specializes in hips and knees. We're talking hips right now. So, Dr. Hood, what type of patients do you see?
Yeah, so short answer is I'll see anybody. If you need help, I'm glad to help you. But I do specialize in hip and knee pain, and that's where my fellowship is from, at Ortho Carolina. And I'm willing to see anybody, but we have same-day appointments. We have appointments available through our walk-in clinic, and glad to see you. Glad to provide any information for you.
Great. So anyone, if you have questions, please feel free to put those in the comment box whenever you're ready. We're going to move on to the next question. Where do you have clinic, and how do I make an appointment?
Yeah, so currently Kona's in 3 different locations. We're in Spartanburg, Duncan, and Greenville. I currently have clinic in Duncan and the Greenville area, and we have walk-in clinics in Greenville and Spartanburg. So there's a couple different avenues. We have a website, kona.care, a lot of resources. If you have questions, need somebody to schedule an appointment, or you can obviously give us a phone call and pick up the phone through our phone number that we have up here, 864-583-KONA. And then also on my website, personal website, markhoodmd.com, there's a lot of information on hip pain, hip diagnoses, and some possible either physical therapy and or surgeries if that's the indication that's needed to be. There's videos, animated videos, handouts, various things, but would love to discuss things. If your hip pain is causing you where you can't do what you want to do and you want to live pain-free and take control of your life, then I'd love to have a discussion, even if it's a discussion about possible options. I love it when I had a patient come in who is overly educated. That makes my day, because they're able to be involved in the conversation and it's not just a one-way street. I like to work as a team and like to educate the patient, but also have them bring a source of education and or misinformation that we're able to correct and turn around for them, but ultimately get them back on the road where they're pain-free. So glad to help. Feel free to give my office a call or call Kona. You can see one of my great partners in order to set that up. We'd love to see you. We'd love to help you. We'd love to help get rid of your hip pain.
Great. Here's a question from a viewer. I just had a total hip replacement 12 weeks ago. Still very swollen and sore. How long do I need to be concerned about infections in my new joint?
Yeah, so total hip replacements, total knee replacements, they can be painful. They can cause swelling for a long period of time. And I don't know your particular scenario, but what I would say in general is you can have swelling and pain for several months. And sometimes people have swelling for up to a year, is commonly reported in some of the literature. So I'd say it's very common. And then to answer your second part of your question about an infection, we're always worried about infection in a total joint arthroplasty, no matter if that's in the shoulder or the hip or the knee. It's something that we're always concerned about because the effects of it or the consequences of it are drastic. It's not something just to shake a hat at. It can cause drastic effects to the patient, to the family, the cost that the patient has to incur. So we're always worried about it. And I would say all total joint arthroplasty surgeons are aware of it and are overly concerned about it, and I'm sure your provider is too. But if you ever have any questions or any issues, we'd be glad to help.
Once again, viewers, don't hesitate to ask a question. Please enter them in the text box if you'd like to know the answer. Not a question, but someone's here saying that you're the best doctor that they've ever seen. So just wanted to throw that out there.
Well, I appreciate the kind comments, and thanks for joining in. Appreciate you guys all joining in, and hopefully I can answer some questions for you or spark new questions that you bring into clinic, either with me or another provider. Hopefully with Kona, but we're here to answer questions. That's what we do for a living, is answer questions and get patients back to what they need to do and what they want to do. And that's different for every patient. Some patients just want to walk from the kitchen to the bathroom, and that's a problem for them, but that's a goal. And if that's the goal that I can help them meet, that's great. Other patients had a Boston Marathon runner the other day who wanted to get back to the Boston Marathon that she qualified for. So it's different in terms of expectations, and we're able to tailor that for you to get you back to the life that you want.
Great, excellent. Well, we're running out of time, everyone. Thank you all. Thank you for joining us tonight. And if you have any questions, please do not hesitate to reach out either through our phone number at 864-583-CONA. That's 864-583-CONA. Or you can reach us through our website. We have an appointment request form on our homepage, or you can go to markhoodmd.com and get more information there. Thank you, everyone, and have a great night.
Awesome. Thank you. Have a good night.